during treatment, I don't care whether anybody has a panic attack or not. What I want them to do is be willing to have a panic attack. When they're all better, a few things need to happen. One is they need to know that anxiety disorders run the life cycle. So you can do great with me, finish treatment in X number of sessions, be off, and be fine, and then 2 years later, you're hit with something else again, or panic again. The problem with being better is you drop your skills. You let them go because you don't need them anymore. Then you get hit with another spontaneous panic attack, and you flip out and forget everything and bolt again, and you got to brush your skills off and put them on again and start using them. So, you know, one of my goals is to make sure those skills are pretty solid and simple, so they don't have to necessarily come in and work with me again in order to get up and running. The message I want people to have when they walk out is, whatever happens, I can handle it. What happens in the middle of the treatment is, you know, okay, on a scale of 0 to 10, I think I can do pretty well with a number 7 panic, and maybe even a number 8 I can manage it. I hope it doesn't get up to a number 9. Well, you can't get there from that position, because you never know how strong your symptoms are going to be when you have a panic attack. If I have a number 10 panic, I'll go insane for a few moments and fall apart, and somebody will take care of me, and I'll recover eventually, and I can handle that too. So that's what we're looking for. And then they need to, you know, behaviorally, they need to be expanding their life and have free movement, not be preoccupied with obsessions all day long, not be doing a bunch of rituals and compulsions in order to control their symptoms and so forth, and be willing to have their symptoms. I wouldn't say that everyone who finishes no longer is anxious, but I would say they're no longer passive. So I don't mind you continuing to have distress and anxiety, but I want your activity level to have tripled. So I'm, you know, what a very passive life. You see, people can be fine as long as they don't do anything. And so we really want them doing the things despite the distress, and then not having full-blown panic attacks anymore. Would, you know, if they're still having full-blown panic attacks, they're not done. We haven't done the job.